Tonight's Healthy Living, it's a national health story with a local voice. A doctor from UC's Gardner Neuroscience Institute shared his expertise with a panel weighing whether or not to recommend a pharmaceutical-grade product using CBD or cannabidiol. That's marijuana-based, and it's long been controversial, but our local doc thinks what's happening now could change that.
This is a historic moment. I think the FDA really looked at this just like like they would approve a regular drug. There wasn't, oh, well, we have to be careful because this is evil marijuana. They looked at it in a very objective way.
And they voted unanimously to recommend approval of the drug known as Epidiolex. It is a cannabis derivative and would be the first prescription cannabidiol medicine. Dr. Michael Privatera has been testing it on epilepsy patients at UC for years now. People like Willie Plott. His parents say for him, the CBD has been nothing short of lightning in a bottle. When I spoke with them in February, they told me they've seen a big decrease in Willie's seizures.
He has gained a new cognitive level. So he's starting to notice things for the first time. He's starting to look around him. He's starting to actually look at us.
Exciting developments that did not come easily.
Any marijuana derivative right now that's from the plant is automatically what's called a Schedule I, which is the most restrictive that the DEA has for any drug.
It means it took Privatera months and months to get a license to do research. He even had to store the product in this big safe in a tiny room in his research building because he would have needed an armed guard to move it from one place to another. That's been the climate surrounding marijuana plant research, one Privatera thinks is changing thanks in part to what happened with Epidiolex last week in D.C. He predicts the breakthrough will lead to more and easier research now.
And it could open the doors for patients who have other illnesses, potentially.
Yeah, absolutely. The way cannabidiol works in the brain will be better understood and will probably lead to better treatments.
Dr. Privatera's role in last week's meeting was to say how the drug has impacted patients. More perspective now. There could be more and easier research, in his words, because if the FDA approves it, which is expected in June, the DEA could change the schedule of the drug. A lesser schedule for marijuana would make medical research tied to it, he says, easier.